I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. Please do subscribe my channel and press bell icon button, then you will receive all my latest videos. Today I'm going to talk about fibromyalgia. Fibromyalgia is very important um, syndrome which affects person's daily life. It's a long-term illness. It causes pain in the muscles and bones. Usually patient comes to the doctor and says that my bones are aching, my body is aching. So there are areas of tenderness. So when doctor touch that area, so patient complains, yes, it is a very painful area. General fatigue, sleep and cognitive disturbances. This condition can be hard to understand. In the past, healthcare professionals were not much aware of the signs and symptoms of fibromyalgia because the symptoms also mimic those of other conditions, for example, chronic fatigue syndrome. But nowadays, healthcare professionals understand very well this fibromyalgia and patients as well. So patients explain their signs and symptoms in a better way. Fibromyalgia can be challenging even nowadays to diagnose, as well as it poses treatment challenges. In fibromyalgia, so patient usually refers regions of pain, and some of these regions overlap with what was previously referred to as areas of tenderness called trigger points or tender points. So the common signs and symptoms of fibromyalgia are fatigue, troubled sleeping, sleeping for long periods of time without feeling rested, headaches, depression, anxiety, trouble focusing or paying attention on different things, dry eyes, pain or dull ache in the lower belly, bladder problems such as interstitial cystitis. There is also one term which is used in fibromyalgia, so that is called as fibromyalgia fog. So in fibromyalgia fog, person experiences memory losses, difficulty concentrating, trouble staying alert. Fibromyalgia symptoms are more worse in women as compared to men. So women have more widespread pain, irritable bowel syndrome symptoms, morning fatigue more than men. Painful periods are also common. So the fibromyalgia disease was, or syndrome was, revised in 2016. So according to 2016 revision, more men are being diagnosed with fibromyalgia, which may reduce the degree of distinction between the pain levels men and women experience. But anyway, more research needed to establish so who is suffering more with fibromyalgia. So what are fibromyalgia trigger points? There are 11 to 18 trigger points on fibromyalgia patient. So if they had a widespread pain, so usually 4 or 5 areas are involved. But important trigger points are back of the head, tops of the shoulder, upper chest, hips, knees, outer elbows. Pain is the hallmark of the fibromyalgia syndrome. Pain can be mild, moderate, but it can be so severe that in some patients or some people, it's unbearable for them. When fibromyalgia pain is in the chest, so it can feel frighteningly similar to the pain of the heart attack. So fibromyalgia, chest pain may feel sharp, stabbing, like a burning sensation. Back pain, leg pains are also very severe. So these are deep, burning and throbbing in nature. Some patients, fibromyalgia patients, they also feel like a numbness or tingling sensations in the legs. So what are the causes of fibromyalgia? Several theories are being discussed by the researchers and healthcare professionals, but they don't know the exact cause of fibromyalgia. Some patients with rheumatoid arthritis, suffering with autoimmune disease, they also experience fibromyalgia. After infections, fibromyalgia syndrome starts. For example, salmonella infections after flu, after pneumonia, Epstein-Barr virus infection, Shigella. It also runs in the families. For example, if elders are suffering with fibromyalgia, so highly likely their children will suffer with fibromyalgia. Um, some people who are suffering with depression, anxiety or stress, so they also complain about body aches, bone pains. So fibromyalgia is also common in those patients with mental or health issues. So what are the risk factors for fibromyalgia? Fibromyalgia flare-up can be the result of stress, injury, illness, as I mentioned earlier, flu, pneumonia, or any other infection. Gender, most fibromyalgia cases are currently diagnosed in women. Probably a woman explain their signs and symptoms in a better way. Age, it affects usually middle age people. Family history is also important. So how fibromyalgia is diagnosed? There is no single test, or there are no tests to diagnose pain or detect pain by any blood test, by any imaging such as X-ray, CT scan or MRI. Usually doctor takes a full and details history, then examine the patient. If there is an infection, then blood tests are done. So, and if there is any autoimmune disease, so that would, the specific or relevant tests would be done. So after the diagnosis or establishing the link between infection or any autoimmune disease or stress or mental health issues, then doctor will start treatment. So pain management is very important. So the painkillers are given to control the pain, because pain is sometimes so severe that it affects person's daily life. It disturbs sleep. So maybe some medication to calm this patient down, and some antidepressant tablets or medication will be prescribed. Exercise is very important in fibromyalgia, and person should make changes in the lifestyle. Diet also plays an important role. For example, eat more fruits, more vegetables, more beans, drink plenty of water, reduce sugar intake, go to bed early, wake up early. Thank you very much for watching this video. So by making changes in the lifestyle, person can, and taking painkillers, acting upon doctor's advice, person can cope with fibromyalgia syndrome. Thank you very much for watching this video. If you have any question, please write down in the comments and I will answer.